Hello and welcome back to my channel. This is Dr. Victoria Givens, your board certified facial plastic surgeon and owner of Givens Facial Plastic Surgery here in Austin, Texas. Today we're talking about a really fun and kind of controversial topic. It's why people have chubby cheeks and what you can do about it. So stay tuned to find out all the good info. We're gonna be talking about some anatomy, who is a good candidate for it, and what the procedure is. And don't forget to hit that subscribe button. Let's get going. Right, so here we go. Fun, exciting topic, one of my most popular procedures and consultation topics that I see with patients on a weekly basis. So, chubby cheeks. Why do we have them? If we want to understand why we have chubby cheeks, or in certain people have bigger cheeks than others, we have to understand some anatomy. So a lot of people are concerned about, is it due to diet and exercise that I have those chubby cheeks, or is it just something I was born with? Well, simply put, there is a singular thing called a fat pad, which is called the buccal, or some people pronounce it buccal fat pad, B-U-C-C-A-L. That fat pad is the main contributor to you having those chubby cheeks or fullness in that area. So what I tell people is it is not the cheekbone, it is not the jawline, and it's certainly not this little fat pad that occurs in the pooch or corner of the mouth. It's actually in this cheek hollow. So this area right here, that's where your buccal fat pad lies. And in patients with very slim, contour defined faces, they have a buccal fat pad, but it may just not be as robust. They don't have excess fat in that area. And in patients with a rounder look, full cheeks, full in this area and full around the jawline, a main contributing factor can be that buccal fat pad is just in excess of what it normally should be. And you can take a good look at possibly your parents, one or both of them. They may have rounder or fullness of the cheeks. And unfortunately, diet and exercise does not make that buccal fat pad go away. Generally, that fat pad, it's not a vital structure, meaning you don't need it to survive. It's okay to take some or part of it out. It just does provide some cushioning and glide, which is what most fat pads in the body do. So this brings us into our next topic of who's a candidate for it. Well, obviously someone with chubby cheeks, but also you may have super chubby cheeks, or you may have just, you want a little more contour of this area. And when you remove this buccal fat pad or part of it in that area, you provide some slimming, but you also highlight the cheekbone to make it a little more defined, and you highlight that jawline. So you directly are contouring this area to provide some slimming and structure, but you're also indirectly highlighting the upper cheekbone and highlighting this jawbone. So it's a win-win situation. I have lots of questions on who's a good candidate for it. Obviously, as we just said, someone with very chubby cheeks is a good candidate. Someone on the slimmer side as well who wants a little bit more definition is also a candidate. You just have to be more conservative. You have to go to a surgeon who knows what they're doing, knows the anatomy, and knows the amount that needs to be taken out. It's a scientific, but also an artistic approach as well. So it's really a big deal to do your due diligence and some good research and go to someone who performs this procedure a lot and sees candidates for this procedure as well. Now, let's get into the actual procedure that I've been alluding to the whole time, called the buccal fat reduction, buccal fat removal, or a cheek reduction. You may hear all three of those terms. I see a lot of patients in my clinic for this. They either have very round chubby cheeks, or they are on the slimmer side and they just want a little bit more contour and definition, a little bit more conservative approach. 99.9% of my patients have this procedure performed in the office, awake, with just a little bit of local anesthesia. It's a very comfortable procedure, and it takes probably about 15 or 20 minutes in total to do. All the incisions, I say all the incisions, there are 2 incisions. There's one on each side. It's about 1 centimeter long on each side inside the mouth. So there are no cuts on the outside of the mouth at all. It's, as I said, a quick procedure, very tolerable, very comfortable, and you do walk out of here feeling like that wasn't a big deal to do, which is great. I do have my patients wear a dressing over their cheeks just to hold some support during that first week. And you basically can tell people that you had your wisdom teeth out. It's the same look or feeling over that first week. So things to expect in the procedure and recovery, I'm gonna do a little bit more in depth of in a very separate video, but I really wanted to go through because I've had just lots of questions over the past few months about who's a good candidate, is it okay to do this procedure? It seems very controversial. It's a great procedure when performed in the right patient by a surgeon who knows what they're doing. So again, I can't emphasize enough, definitely do your due diligence. Come and see me for a consult, either in the office or virtually, and let's get you going so that we can have a defined, contoured, conservative, natural look. Thank you for staying tuned today. Don't forget to hit the subscribe button, and I will be seeing y'all again soon. Bye.